There's two different heart cycles. The first one is the systemic, which takes blood from the heart to the body, and the second is the pulmonary, which takes blood from the heart to the lungs to be oxygenated. So after the blood leaves the heart through the pulmonary semilunar valve, it goes through the pulmonary artery, travels to the lungs, where it is oxygenated. It then returns to the heart through the pulmonary veins, which would be right up here, but our heart doesn't have it. It then travels into the left atrium, then through the mitral or bicuspid valve, and then it goes into the left ventricle. Once it is here, it leaves the heart through the aortic semilunar valve, which would be right up here, or in this half you can see it goes right up through here. It then goes into the aorta and then nourishes the body tissues. So there are some major structural differences between the right and left sides of the heart. As you can see here, the right side or right wall of the heart is much thinner than the left side or left wall of the heart. So the four valves of the heart are as follows. So the tricuspid valve is right in here. Then the bicuspid valve is right here. The aortic semilunar valve is right here. And the pulmonary semilunar valve is right here.
So these are the four chambers of the heart. So right here is the right atrium, then below it is the right ventricle, and then the left atrium is up there, and then the left ventricle is on the bottom.
Superior and vena cava would enter into the right atrium right here, but it is not shown. So the pulmonary artery and the aorta would be right up here, but they are not shown. And the pulmonary vein would also be up here, but it is not shown. And our coronary arteries are right back in here, inside that area, behind this flap. So first, in the cycle of the blood flow, the blood comes in from the tissues and goes in through the superior and inferior vena cava. Then it goes into the right atrium, through the tricuspid valve right here, and then into the right ventricle. And then it leaves the heart going through the pulmonary semilunar valve, which is right there.